Our thanks are extended to Her Excellency Dr. Mariam Ibrahim Al-Hajri, His Excellency Dr. Hari Jokadar, His Excellency Dr. Hussein Abdurrahman Al-Rand, Mr. Ghassan Aboud, Mr. Simon Bland, and Dr. Rana Haji. And finally, thank you to Mr. Greg Karlstrom for moderating the panel. Ladies and gentlemen, with an estimated total population of over 1.2 billion across 54 countries, 33 of which are classified as least developed countries, LDCs, the continent presents a significant funding and logistical challenge for the authorities and NGOs working to ensure equitable access to vaccines across all communities. Our next panel brings together a range of experts to talk about how supply chain partnerships can help to bridge the gap, overcoming financial and infrastructural challenges to ensure all populations receive access to the COVID-19 vaccine. With that said, let us invite the panelists onto the stage, and they are the Honorable Minister of Health for Nigeria, Dr. Osagi Ihanire, the Honorable Mutahi Kagwe, Cabinet Secretary, Ministry of Health, the Republic of Kenya, David Hadley, Chief Executive Officer, Mediclinic Middle East, Kashif Khalid, Regional Director, Africa and Middle East at IATA, Bruce Mukaya Oriana, International Committee of the Red Cross, Head of Delegation in Addis Ababa, Permanent Representative to the African Union, and the panel moderator, Turlock Mune, Associate Director, Port Analytics at IHS Markit. The stage is yours.
A very good afternoon and welcome to this session where we will focus on Africa and the complex logistical challenges to ensure equitable access to vaccinations across the continent. With so-called vaccine nationalism very much on the rise in different parts of the world, there is some concern over the distribution of vaccines to poorer regions of the world. Africa has an estimated population of over 1.2 billion people across 54 countries, 33 of which are classified as least developed countries, and so presents a significant funding and logistical challenge for authorities and NGOs working to ensure equitable access to vaccines across all communities. It is, of course, also a major recipient of vaccines under the COVAX program, but much more is needed, and even when supply is available, the challenge to distribute and administer vaccines while retaining the integrity of the cold chain can be a stark one, particularly in poorer and remote regions or those experiencing some form of conflict where infrastructure and efficient health processes can be extremely limited. Well, to discuss the current situation with the vaccine rollout in Africa, I'm joined by 5 very distinguished guests. The Honourable Dr. Osagi Ihanire, Minister of Health of Nigeria, Mutahi Kagwe, Cabinet Secretary for Health, Ministry of Health, Kenya, Kashif Khalid, Regional Director, Africa and the Middle East with the International Air Transport Association. David Handley is CEO of the Middle East operation of Mediclinic, an international healthcare services company founded in South Africa. And Bruce Mukaya Oriana is the ICRC, the Red Cross Head of Delegation and Permanent Representative to the African Union. A very warm welcome to all of you and thank you so much for joining this session today. Minister Ihanire, perhaps I can start with yourself. We had a brief conversation just before we came on air. I was wondering if you could give us some opening remarks about how the vaccine rollout in Nigeria is currently proceeding.
The vaccine rollout in Nigeria is going on smoothly. We have had no hitches. We received a consignment from the COVAX facility and we had good time to prepare for it and have distributed the vaccines along the 36 states of the Federation and the Federal Capital Territory where activities are already going on. We had some good training before the vaccines arrived and the logistics are well prepared and the operation is has now not given us any complication at all. We have had no incidents.
So it sounds like it's going quite smoothly. Why would you say it has been going quite smoothly? What are the key reasons for that?
Well, part of the key reasons is that we were prepared for it. We had plenty of time to train and to organize ourselves. And I must say, we also had time to look at the other countries, the developed countries where the rollout was going on, and listen very well to the errors we think they made or to the complaints they had, and try and organize ourselves in such a way that we didn't have such hitches they had, and the delays and reports of delays in advanced countries. So it's like having a sort of a head start in preparing for the rollout, and the quantities we got were manageable quantities. So I believe those are the reasons. And we also have, let me add again, a very well-oiled organization, the National Primary Healthcare Development Agency, which is quite normally responsible for routine immunization all over the country. They do that as their job. And we just a few months ago became certified as polio-free after a campaign to eradicate polio in Nigeria. It is this same organization that conducted that very successfully.
Cabinet Secretary Kagwe, if I could maybe bring you in here, is it a similar story in Kenya? Has it been a relatively smooth rollout of the vaccine so far?
I would say so, and I agree with my brother from Nigeria, because it's been. I think the first thing to note is that Africa is not new to vaccinating its people. That's the first thing, because there is an established system already that we have been using for several years. We carry out immunization throughout the year. We do immunization for polio for children, and so on and so forth. So the rollout of vaccines is not a new phenomena as such. The only difference being that in this particular case, it's a lot bigger. You know, the quantities of and the population of people we are vaccinating is bigger. And secondly, it is focusing on a population that we don't usually vaccinate, and that's the adults. So in terms of the rollout, again, yes, we got our vaccines from the COVAX platform. We have rolled out over the last 3 weeks or so. And the way we did it ourselves is we did it sequentially, so that you start from the big hospitals and then roll down to the smaller hospitals and the other subsidiaries, so that it is there is a system in place. The other issue is the digital platform on which we use to identify the particular batch and must be related to a particular person. And the challenge here being, of course, that unless you have got very well-grounded data, then when you come round to vaccinating the second time round, it becomes a bit of a challenge. So I would say that the rollout has been successful so far. We are increasing every day. We are growing exponentially in terms of the numbers that we are growing to every day. And it's only 3 weeks. We've only done it for 3 weeks. And of course, there are areas, again, as you rightly said yourself, Mr. Moni, there are areas where you'd face certain challenges, but they are not insurmountable issues so far.
So what would you see as the key challenges with this going forward over the coming few months?
Well, I don't know whether you mean about the challenges internal or challenges external, because the biggest challenge, of course, is getting the vaccines. You know, the biggest challenge is the supply aspect of it. Because even as we speak today, yes, we have received some AstraZeneca vaccines, but there is no telling in real terms when under the COVAX facility when the next ones are coming. And from what we are hearing on what you are calling vaccine nationalism, you know, what obviously is happening is that, for instance, the ones that we got came from India. And now we are being told there might be challenges because the Indian government, of course, wants to take care of the Indian people first. And this nationalism, to me, is the biggest single challenge. And what is likely to happen within the African continent is that there will be instances when people have been vaccinating, perhaps start with the first dose, and the second dose might take so long that the first dose, then the relationship between the first and second doses become challenged. So I think the supply aspect of vaccines globally is the challenge. Having said that, we have also seen for the first time that under the COVAX arrangement, under the Gavi-COVAX arrangement, this is the first time probably that medical facilitation is happening as closely as it is between developing countries and developed countries. But to me, that is the bigger challenge is not the internal challenges. The bigger challenge is the external challenge.
Minister Ahenire, would you agree with that point of view, that the main concern is perhaps some over-reliance on the COVAX system and where the vaccines are coming from outside of the country?
Yes, I do agree with him completely. There's a certain unpredictability that is in there right now. We have received a certain amount of vaccines, and we had all hoped that within the next month or two, we will know when the next batch will come in. But right now, we do not know, and there is no way to be able to make a plan, or even if we made a plan, to maintain the plan if we do not know what doses are coming in, when they are coming in, and what sorts of doses are coming in. So that is a major challenge. The supply chain there is not robust enough, and we would like to see that improved upon. Of course, we are hoping that in the nearest future we can get the single-dose vaccine from Johnson & Johnson, which will save us quite a bit of trouble of looking for your patients to take the second dose. But so long as that is the only vaccine available, the question of the second dose is looming right there. When we can do it, how we can get patients, and when we get the vaccines. So those are the issues which are actually in the forefront. The internal challenges are fewer than we thought. We're not receiving any ultra deep freezer vaccines like Moderna or Pfizer. So we are not that challenged with those ones at the moment.
Mm-hmm. So how reliant are you on the COVAX program? I understand that there are other sources of vaccines as well, other countries making some donations and some purchases too. Is that correct?
That is correct. We do have the promise, or the assurance of COVAX to provide vaccines for 20% of our population. We have had indications that could, in fact, even be more. But if we have the 20% and we are aiming for 60%, in our case, we are in fact aiming for 70% coverage, then we have to make up the remaining 40 to 50%. And we are going to be sourcing that on the same market as COVAX does. And we are working with the African Union, the AVAT facility, as you might know, the African Vaccine Acquisition Task Team, under the President of South Africa, is working to take care of the needs of Africa outside of the COVAX facility. We are working with them, and it is backed, as you might also know, by the Afrexim Bank, and to ensure that money is not immediately a problem or a hindrance.
And is there, have you been given a schedule for receipt of the vaccines, or it's more a volume commitment over an extended period of time, or how does that work?
Well, we have been given a volume commitment. We were given tentative time commitments, but there's no assurance that they will be able to hold on to these commitments as far as the time is concerned. We know, for example, that they had 270 million doses. I'm talking now about the AVAT, the African Vaccine Acquisition Task Team, boosted recently by another 300 million. So on paper, 570 million doses, which is very good, it's very promising, very reassuring. But the time frame for receiving these vaccines does not lie entirely in the hand of Harvard either. Neither does it lie in our hand, and it doesn't also lie in the hand of COVAX. And that's where, again, your point of vaccine nationalism begins to come up, in that the manufacturers prioritize certain countries for whatever reason. But our view is that this the COVID-19 is a threat to mankind. And so all of mankind needs to be given attention. All of mankind needs to be given access to the vaccines so that the world will be the way we know it.
Yes, indeed. Mr. Orina, if I could maybe bring you in here, Cabinet Secretary Kagwe, mentioned, the fact that there's quite a lot of experience in Africa in terms of inoculation campaigns and so on right throughout the region. We've also heard Ben Schreiber, the coordinator of COVAX at UNICEF, has expressed optimism about rollout of vaccine in Africa, given this experience of so many large vaccination campaigns over the past 10 years and before that. Do you also share that optimism? Does the Red Cross share that optimism?
The vaccines are arriving, I think, as the two ministers have mentioned, and we observe that vaccines are starting to arrive. But of course, the numbers, the volumes are still low, because even COVAX that I had allocated nearly 20%, the arrivals are still well below 20% of that 20%. So in terms of the volumes that are arriving in the continent, we still see that the volumes are low. Now, in terms of the experience that we have in the African continent, I agree with Minister Kagwe that national societies, the African national societies, Red Cross and Red Cross societies, are auxiliaries to public authorities, and they work very closely with national governments through community mobilization and working together when it comes to vaccination. So that experience exists. The infrastructure in terms of human capital, in terms of volunteers of the Red Cross and Red Crescent, exists. The experience is there, and what we have been discussing also within the Red Cross Red Crescent movement is what kind of support can we bring to the African governments to ensure that when we have sufficient volumes, we can support them in the rollout. But of course, there is a challenge, I think, and that is what we have also observed, that in a number of contexts in which we are operating, COVID-19 came on top of already existing challenges when it comes to conflicts and other impacts of conflict that a number of other countries continue to suffer, which have led to either destruction of some of the public health facilities or malfunctioning of these facilities due to, of course, absence of the necessary resources or challenges related to access to some of these places. So, of course, that is one area, obviously, when the rollout starts in earnest, that we will start to see those challenges coming in. But a number of countries across the continent, in the countries in which we are present, have shown a remarkable commitment to not only include in terms of categorization the various categories that they had in terms of healthcare workers, but also a number of countries have included also refugees, detainees, and migrants. If I give an example of Rwanda, for example, that started their initial vaccination to include detainees, refugees, and migrants. So this, of course, this commitment is there, but of course, it's very much subject to availability of sufficient vaccines for the countries to be able to roll it out across all the populations.
Yes, so certainly very encouraging to see the commitment and the arrival of vaccines already, and as you point out, the relatively successful distribution in various parts of the region. But there are countries that have been in conflict for several years and beyond, and these countries are facing the additional burden of health facilities that are already quite fragile, and they also are responding perhaps to other health emergencies and so on. So you mentioned that the experience in dealing with pandemic and so on has created some human capital and so on, and processes to deal with this kind of thing. But what about hard infrastructure? I mean, stuff like ultra cold chain infrastructure, infrastructure for handling the vaccines in very remote parts of the country, for example. Surely that must be something of a challenge.
Yeah, but I think if we now look back to February, March 2020 and look at the capacity that existed in the continent in terms of testing, we have seen that most of the countries have really been able to ramp up their capacities, and through collaboration and support of the Africa CDC, I think we have seen these capacities increasing. And also, of course, when it comes to supply chain and other support, we see that is starting now to increase. Of course, as the Honourable Minister from Nigeria said, so far, of course, to the extent that we are mostly, vaccinating using AstraZeneca, that requires lower temperatures in terms of storage. The challenge is much less. Of course, later on, we will have to see how that happens. But I agree with you that a number of countries will face challenges, and one of the challenges, of course, is the one I spoke about: access, especially where access is restricted due to insecurity, and not so much necessarily of infrastructure, but in fact the inability to access populations because of constraints linked with the insecurity. But this is really where I feel that the private sector as well will need to be harnessed, because I think it's important to think about this crisis as a crisis that affects all of us, and even the private sector. I think with their capacities and possibilities that they have, especially in terms of logistics and transportation, there would be need to work together and support governments and communities, and also, in fact, also to reflect in terms of what contribution can communities also make when it comes to some of these questions. So these are some of the issues that we continue to reflect on, and also for us as ICRC, what kind of support can we bring, especially in context and areas where we see that either governments may not have full access to all the populations, and therefore what kind of support can we provide, knowing that ICRC in terms of its modus operandi do have access to also areas that are controlled by non-state armed groups, and therefore this kind of support is support that we can bring as well.
Is there evidence that the private sector is getting involved here and contributing in a way that's really going to make a very big difference?
I mean, if I take the platform that Africa CDC has set up now, the Africa Vaccine Delivery Alliance, that brings together a number of actors, ourselves, WHO, UNICEF. We also see other actors like DHL also present in this platform, where they are also making their contribution in terms of not only offering their service, but also in terms of technical sort of advice in terms of what needs to be done, what needs to be done. I mean, we see airlines like Ethiopian Airlines, the Kenya Airways already So we see that the private sector is coming on board, but I'm also thinking about the role that telephone companies, for example, can play when it comes to, for example, looking at the whole digitalization and access to populations. I think today connectivity in Africa is advancing, and I think we need to reflect on how we need to leverage on the issue of digitalization for purposes, and this is where private sector companies can also contribute in terms of offering some of their platforms, especially in terms of reaching out to populations through either an SMS system to alert populations that need to be vaccinated to come on board. So there are different innovations that can come up in order to speed up and scale up the vaccination campaigns.
And Cabinet Secretary Kagwe, if I could go back to yourself, because I think you also mentioned the importance of digital systems, both in distribution but also in terms of tracking, who has received vaccines and when and so on. So how is Kenya managing all of that process? How is it gathering the the digital resources that it needs to be able to do this effectively, or is it a major challenge?
Thank you. It is not a major challenge, because essentially what we are doing is that we have created our own platform. That's first and foremost. We created it ourselves. Secondly, as Orina has just said, we have a very robust activities in terms of the mobile platforms. We have created this platform, which we are using material that we have used in the past. For instance, the parts that we are collecting data with are what we used during elections. So we didn't have to buy, this equipment. We just went to the stores and collected the equipment we use for collecting data during an election period. And that's what we are using across with all the people who are vaccinating. So it's very straightforward. What we are doing now essentially is saying that if you want to be vaccinated, then you log on to your mobile phone, and on that platform, you can even book a time and a place where you would like to be vaccinated. That way, you get information. And the records that we have are such that nearer the time for your second dose, then we are able to alert you and tell you that you need to go for your second dose. So the whole thing is digitally managed. There is no manual management of the system that we have rolled out ourselves.
Mm-hmm. And are you also confident that a system like that, it sounds like if you have a policy in terms of who gets vaccinated first, which maybe more vulnerable sectors of the population start getting vaccinated first, health workers, older people, and so on. Are you confident that this platform helps you to achieve that strategy effectively?
Absolutely, and one of the advantages that you have with a system like that is essentially you identify the individuals. So that, for instance, and like you rightly said, the rollout first in Kenya is healthcare workers, but and frontline workers as well. We have got the teachers who are in schools. We have got policemen who have to work with a lot of people. We have got clinicians and other healthcare, the whole kabash of the healthcare workers, including the healthcare, the community health providers. We have got two categories on board, and those are community health volunteers and community health workers. And those make a huge part of the management of our infrastructure. A lot of our people are on home-based care in terms of the isolation facilities. Home-based care people rely on the community health volunteers in order for them to be taken care of. And talking about working together on this platform, for example, we are engaging the ICRC and Red Cross so that we are using, in future, we are going to use the ambulances so that instead of people queuing in places, they simply go with the pads, visit people's homes, particularly the older people. From Friday this week, we have moved on to the 58 plus, and some of them are pretty old people who are not going to be able to come out of the centers. And the way we are tracking those ones is by the community health workers essentially tell us where these people are. We use the ambulances, and using a system we call Nyumbakumi, or 10 homestays, we can identify them very easily and move there and simply vaccinate them where they are. So essentially, we are using a system that is already in place. We are not going to buy new vehicles. We are not buying new ambulances when the Red Cross has them. So we use them. And where AMREF has got aircrafts that can deliver some of these things, so we use AMREF. And where necessary, then we have got our own ministry transportation system. I think the other thing to remember here is that in Kenya, health is a devolved function. So we have got 47 governments that are all involved in trying to reach as many people as we can. And the problem is not uptake. The problem that we are having in most African countries is not a problem of uptake. It's a problem of availability. So at the moment, the challenge is that we have to keep on repeating and telling people, please don't come to be vaccinated because it is not your turn yet, which is a pity, because as many people as possible, we should be vaccinating as many adults as are coming to be vaccinated. But because of the supply problems, then you are left with that unique problem. So yes, the system is working. It is very, very useful, because you can imagine the amount of data and the amount of paper you'd have to use, to vaccinate millions and millions of people. So to us, this is the only way that it can be done.
And David Handley, if I could turn to you, you're with Mediclinic, a private healthcare services company. Just from chatting before we came on air, I think you mentioned you have more than 50 clinics in South Africa and Namibia. I'm wondering what has the role of Mediclinic and the wider private healthcare service sector, say, been in managing the pandemic, first of all, and then in terms of the vaccine rollout as well?
Yeah, thank you very much for the question. I think it's been an interesting journey across the world, and we're not only represented in Southern Africa, we're in other areas as well. And what we've seen is the collaboration between the government and private has been better than ever, in a sense. We've had to work together to deal with this pandemic. And in Southern Africa, the team in Mediclinic Southern Africa have really stepped up and have had to deal with this pandemic head on. We received multiple admissions. We stopped our elective work so that we could accommodate the COVID admissions, and we had multiple admissions across all of our facilities across Southern Africa. So it really was a team effort from the government and our hospitals to be able to deal with the sick patients and to manage the pandemic together with them. And I think we can be very proud of the achievements that were attained in the country. On top of that, I think Southern Africa has proven to be a fantastic country in terms of their testing. I think in Africa, we're all used to the fact that we have to test for TB and for HIV/AIDS and other diseases that have been seen in Africa. And in Southern Africa, it's been the same. And I think it's now well known that in Southern Africa, we detected one of the first mutations, which is now known as the Southern African mutation of the virus. So we've had to deal with these various mutations of the virus as well in our facilities. And as we saw, the second wave came, and we managed that very well as well. So it's been a really close collaboration between the private providers and the government providers in dealing with the pandemic. When it comes to the vaccine, it's been interesting to hear the honourable gentleman together with me in this forum talking about the challenges with supply, and I think that has been the challenge across Africa, and no different in Southern Africa as well. And at the moment we are, as you know, working with the government to trial the J&J vaccine, and hopefully that can come into full-blown distribution shortly. It's a single dose, and obviously would be fantastic if we could get that into production and into the markets as soon as possible.
Thank you. And how are you seeing the phasing of priority-based vaccination systems rolling out across the different locations where Mediclinic operates?
Well, I think it's been, like the gentleman have been saying earlier, it's been driven through the government, and it has its challenges in terms of logistics, in terms of the IT infrastructure, capturing the data to ensure that the first and the second dose, there's not too big a gap between. That's why the J&J is quite exciting if we can get the single dose going. But we, if I'm honest, I think the whole rollout and the whole dealing of these vaccines, we're ready for it. We're ready to get going, and we're looking forward to dealing with this rollout of the vaccines as soon as possible.
So you mentioned the IT infrastructure there, and I know you also have clinics in the Middle East. I'm wondering, and some of the honourable gentlemen earlier also mentioned the government platforms and so on. I'm wondering, from your vantage point, is there a major gap between the IT platforms and capabilities in parts of the Middle East, say, and parts of Southern Africa? Because we do hear, of course, that IT can be the great leveler, and if it's introduced and the processes around it are good enough, it can result in a significant jump in efficiency, where in the past maybe other infrastructure, wasn't quite as effective. Is there a big gap in terms of infrastructure used in healthcare, in things like vaccine supply, tracking, between, say, more developed economies in the Middle East and parts of Southern Africa where your clinics are?
I think we definitely see that. I think the high-income countries have the privilege that they can afford these IT infrastructures, these applications and the platforms to be able to embrace the technologies that are available today. We're very fortunate in the UAE that we have many of these platforms available to us. We have health information exchange platforms in Abu Dhabi, especially with Malafi, but we also move very, very quickly, again, public and private working together to create applications and platforms to be able to monitor the number of PCR tests done. Have you been vaccinated? Is it loaded on an application? And I myself have had both of my vaccines. I'm fortunate enough to have had both of my vaccines, and I can click a button and there's my vaccination card. And I'd be interested to hear how that links in with IATA later. But I think we're very privileged that in the UAE that we have those platforms available to us. Now, the backbone and the technology is available in Africa, but I think a lot of the front-end applications are not as available as we see in the more developed world, and we are certainly experiencing that in Southern Africa as well. We make our way around it, but it's certainly a lot more challenging than what we're seeing here in the Middle East, in the UAE, for as an example.
So what needs to change for the front-end stuff to get in place? Is it simply a matter of funding, or is it more policy? What do you think?
I think funding plays a big role, because a lot of these IT infrastructures are dollar-based, and obviously as you move into the more developing countries, they're expensive technologies to adopt, and they can't easily be afforded by, for example, in the private sector. They can't easily be afforded on the current pricing available in those markets. But it's certainly something we're working towards, and as we always do in Africa, we find a way around it, and I'm sure that they will find their way around this and be able to adopt these new technologies sooner rather than later. This pandemic has certainly taught us the value of data, being able to monitor how many ICU beds we have, where where we're seeing the concentration of patients, et cetera, et cetera. So I think everybody is stepping up their investment and their interest into front-end technologies. But you need the backbone. And in a lot of the cases in Southern Africa, at least, we don't have electronic health records that can link into the health information exchanges, which then the government can use to have an oversight of what's going on in the country. And there's definitely a roadmap that needs to be followed for us to be able to do that. And it's certainly in the pipeline.
Mm-hmm. Mr. Khalid, and my apologies for the amount of time it's taken to come to you. We have a lot of very interesting panelists on this session. But we're all very keen to hear about the air cargo side of things, air cargo operations, obviously front and center in the global vaccine distribution challenge. And I would expect that is also the case in Africa. Maybe you can give us an idea of how air cargo operators are adapting to be able to help us meet this challenge on the continent.
Sure. Thank you for that, Turlock. So from an industry perspective, as we all know, ever since the onslaught of COVID-19 began, the biggest challenge that not only the aviation industry, but other industries have faced is the loss of capacity and connectivity. So if we take a step back and look at the last 1 year, in exactly March 2020 and April 2020, nearly 95% of global aviation activity collapsed, where governments started shutting borders, putting in restrictions, and limiting the flow of people across borders. So the first thing that the aviation industry needed to do was to adapt so that cargo could still move freely across borders, even though passengers were prohibited. And if you recall, all of us went through towards the end of the first quarter in 2020 and the second quarter, the distribution of face masks, sanitization equipment, respirators, and ventilators. And it was the air cargo industry that kept them flowing across borders. Within Africa, one of the biggest challenges that we have is not only the capacity challenge, but connectivity as well. With the loss of passenger flights in 2020, we've seen nearly 2/3 of all passenger aviation activity cease to exist on the African continent. And while we know that it's a loss for passengers, that connectivity, but a lot of cargo historically used to move in the belly hold of those passenger aircrafts across borders into Africa. So with the loss of passenger flights, now that cargo becomes even more valuable and freight operations need to take place to ensure that not only personal protective equipment, but now vaccines can reach the most remote parts of Africa. Late last year, IATA put out a statistic that if we needed to administer a single dose to about 7.8 billion people around the world, that single dose would require nearly 7,000 or 8,000 Boeing 747. So that gives you a scale or appreciation of the logistical challenge. So from an industry perspective, that capacity and restoring connectivity to the African continent is important. Also, governments that have stringent health measures such as quarantine and stringent testing are a deterrent to restoring that connectivity, whether it's for passenger operations or cargo operations. But also, as alluded to this panel earlier by my fellow panelists, the capabilities, the infrastructure, the peoples and processes, but also ensuring that we have adequate border facilitation measures. As pharmaceuticals are time-sensitive goods, we need to ensure that not only do we have the temperature control regulations and requirements, but also customs and border control agencies are able to facilitate those vaccines in the fastest manner possible.
And just on the capacity issue, it sounds like from speaking with the other panelists that the vaccines are getting through, partly because supply isn't as high as it probably should be. So can I take it from that there so far hasn't been any strain on the air cargo part of the supply chain in Africa?
Well, from an industry perspective, as mentioned, due to the erosion of scheduled passenger operations, we've seen a nearly 2/3 loss of capacity for cargo as well. And now, essentially, any goods coming to or going from Africa need to be on either dedicated freighters or airlines need to look at innovative ways of serving the African continent. One of the things that the industry did was very quickly respond to converting passenger aircrafts for cargo operations. So the likes of Kenya Airways, Ethiopian Airlines on the African continent were very quick to retrofit or modify aircraft so as to be able to carry face masks, personal protective equipment, and now vaccines using aircrafts that were originally designed for passenger movements. The challenge for Africa historically has been connectivity, not only to international markets, but also within the African continent as well. And as and when vaccines become available and the COVAX facility or other procurement methods become more popular, that connectivity to not only the major hubs such as Addis as well as Nairobi, but also to the tertiary and remote parts of Africa becomes even more important.
Mm-hmm. And how does the, on capacity aside, how does the integrity of the vaccine air cargo supply chain be maintained? I mean, clearly, it's technically very complex. You need to move the vaccines around, and they need to be stored at very sometimes extremely low temperatures. I know that IATA has, looked at standards for pharmaceutical transports and cold chain. Are those standards now bearing fruit in places like Africa when you have a situation like you have to distribute a large amount of vaccines in a relatively short period of time?
Absolutely. So transporting vaccines is also much more complex than other goods. It requires a network of, as you rightly mentioned, temperature-controlled facilities and handling standards, as well as security. Essentially, these vaccines are quite valuable, and states and people involved in the ecosystem, such as airlines, airports, ground handlers, customs agencies, need to treat these vaccines as extremely valuable and let's say, handle them as per temperature-controlled guidelines and regulations. From an industry perspective, IATA has developed guidelines on the carriage as well as the transport of vaccines. We've also worked with our partners, the airlines, the airports, and governments to create independent validation audits so that stations throughout Africa are able to manage the flow of vaccines irrespective of who the manufacturer is. But also what we've done is, I heard the importance of data. We've created an online repository of cargo and pharmaceutical information for the industry through a program known as OneSource, which lists by airport, by airline, ground handler, the capabilities for these stakeholders to manage the cold chain pharmaceutical products that are coming through, not only in the African continent, but in markets in the Middle East, as well as around the world, so that stakeholders, governments, have a much more informed decision-making ability based on the solution providers that are out there.
So the supply chain integrity, to a great extent would rely, I assume, on visibility and the data, storing and processing that you mentioned. Are those processes at a level that is sophisticated enough right across Africa for everybody to have faith in?
Well, I think from an industry perspective, again, you have major hubs such as Addis Ababa, Jomo Kenyatta, and Nairobi, as well as South Africa. And then in the Western Central West Africa region, they are fed largely by Europe, but also through the major hubs such as what Ethiopian Airlines and Kenya Airways is doing. But also, let's not forget that the vaccine distribution is part of a larger ecosystem. So it's very much possible that the likes of Emirates Airlines, Qatar Airways, and Etihad Airways, which is part of the HOPE consortium, will be transporting vaccines from these massive logistical hubs in the Middle East into the African continent because they've got the frequency, they've got the dedicated cargo aircrafts, and they're able to connect those vaccines much more efficiently from all around the world into the African continent. So while we do have those major hubs on the African continent, many of the hubs around the world will be feeding into the continent as well.
Thank you for that. Minister Hanire, if I could go back to you. So Mr. Khalid there was speaking about the importance of supply chain integrity. That's also, of course, something that gives people confidence in quality of vaccines, and confidence in quality has a direct impact on their willingness to take them. I'm wondering, have you had problems with people who don't have sufficient confidence in vaccines in general, or vaccines with very complex supply chains, and there's concerns over risks to integrity of the supply chain, that's perhaps making some people somewhat reluctant to take the vaccine?
Well, everywhere in the world you have vaccine hesitancy. Everywhere you have people who do not want to be vaccinated, people who resist any kind of attempt to vaccinate them. We had that some time ago against measles in the United States and some other countries. But here in Nigeria, you have people who also do not want to take a vaccine, who have said that they do not need a vaccine. They do not believe in that there is anything like COVID-19. But we do have enough people who want to have the vaccine. And we're lucky to have a good legacy from the polio immunization effort, the polio eradication initiative, which left us with a lot of equipment and infrastructure. We have state-of-the-art cold chain storages in major airports and in zonal storages, and also at the very small locations at the ward level, you have direct drive solar powered refrigerators, which can take the temperature storage at the temperature at which you want your COVID, at least the AstraZeneca vaccines. So we have no problem with that. We have a lot of experience with moving vaccines around the place in routine immunization, and very recently in the polio eradication effort. And if there is any hesitancy, it is not connected with the integrity of vaccines. The integrity is quite well maintained as far as our own operations here are concerned.
And Cabinet Secretary Kagwe, is that a similar situation in Kenya? Is there confidence in the integrity of the vaccine, the physical supply chain, as it were?
I think that the hesitancy on the vaccines has a lot to do with global stories about the efficacy and what is happening elsewhere. When, for instance, European countries stop the use of AstraZeneca, then you get that hesitancy and you get questions in people's minds. And when we also say that under normal circumstances, there would be hesitation anyway about vaccines everywhere on Earth. But when you talk about emergency use, because essentially what is happening is that we are in a clinical trial, almost a global clinical trial, because there is no telling what is going to be happening at the end of this year, and people are aware of that. And the resistance that you see, however, has nothing to do with the integrity of the vaccines as a result of the global chain. Because, for instance, in Kenya, the Gavi cold chain equipment optimization platform is what we have in use, and it's huge capacity. Again, because of the continuous immunization programs that we have. So that's not a real problem. The problem, or rather the challenge, would be where people are doubtful about the vaccines, and therefore the need for an intensive risk communication campaign to address that doubt.
So with a certain amount of hesitancy, as you have in every country around the world, with the supply challenges that we discussed at the start of the session, how long do you really are you optimistic that in Kenya and in Africa generally, that this point of herd immunity, I think it's sort of 60-70% of population immunized to achieve that. Are you optimistic that's achievable within a reasonable time frame?
Well, two things about the herd immunity. The first one has to do with the natural herd immunity. It's only that we don't really understand it yet, but there is a natural building of herd immunity anyway, particularly within the African countries where the virus symptoms are fairly asymptomatic. And in fact, one of the questions that have arisen in discussions on this issue is to what extent is a person who has had the virus immune enough not to take the vaccine? And since there is no answer to that, everybody kind of takes the vaccine. But the question, the question at hand is not really whether we can build herd immunity. We can build herd immunity if the vaccine is available. The issue then becomes that how long will it take to build that herd immunity? Will we build herd immunity as a result of vaccination, or are we building herd immunity as a result of people getting the virus anyway, being infected by the virus anyway? So these are technical questions that have got to be answered. But if we are talking about the purely building herd immunity on the basis of vaccinating 70% of the population, then this is likely to take a little bit of time. When you look at the promises that are there even today, and I go back to what my brother from Nigeria mentioned, as well as Mr. Orina, by now, some 40 million doses are supposed to have been distributed from the AstraZeneca, from the COVAX facility. So far, only about 12 million, as far as yesterday's reports are, it's about 12 million that has been distributed. Now, when you think about 12 million, and you take the time, and if you ask today, it's not a question of money, it's a question of supply capabilities. So when you look ahead, and today, if you walked into the market today, and you said, I want to buy some 5 million doses, either on the COVAX facility, the AU facility, or any other one, you would be hard put to know of a supplier who can get those doses in the next 3 weeks. Mm-hmm. So, for instance, we think that the Johnson & Johnson production lines might be very, very useful for Africa. But even then, you're talking about potential production starting sometime in June. Now that takes you towards December into the next year, and so on and so forth. So I think that this immunity, the herd immunity on the basis of the supply, on the basis of vaccinating people, is a challenge. Mm-hmm.
So we just have a couple of minutes left, and thank you very much for that, Cabinet Secretary. But perhaps I could go round to everybody very quickly and get their view on the issue that, which seems quite apparent to me from this discussion, that the biggest concern is the external supply of vaccines. Is that something that everyone would agree with? Perhaps I could start with yourself, Mr. Hadley.
Yes. Sorry.
Yes, I would agree with that. I think we, listening to what everybody says, it's not only in Africa though, but as particularly in Africa, is the supply of these vaccines. Everybody would like it as quickly as possible because we'd like to vaccinate our populations as quickly as possible. So I concur with that.
Mr. Orina?
Yeah, but I think I would like to add one more point to say that, of course, COVID-19 comes on top of other challenges that exist for populations. And I think it's important to underline that the continuation of vaccinations, routine immunizations is as important. It's also important for us to continue to think about other challenges that populations continue to face in terms of what the impact has been on livelihoods. And then therefore, because as we have been working with populations across the continent, many people clearly are raising issues in terms of needing other other health needs and other livelihoods challenges, and therefore it's important for that also to be borne into account, so that there is support for populations to continue to improve their health needs. The last point I want to make really is more an appeal to the government to continue to include those populations that are vulnerable, and especially those countries that have large concentrations of IDPs, refugees, and migrants within the continent, to continue to pay particular attention to that, knowing the vulnerability of these categories of population.
Indeed, indeed. Mr. Khalid, do you have some final words before we wrap up the session?
Sure, no, absolutely. Having a vaccine is only the beginning. We need to get it to the far most remote places, not only in Africa, but around the world. But also governments need to work diligently to restore that capacity and connectivity, and also support the aviation industry towards restoring that connectivity, which has eroded over the last year.
Thank you very much. And Mr. Ehaniri, the final words from yourself?
Well, yes, that we fully support equitable access to the vaccine, and the distribution mechanism needs to be improved upon, so that all persons, all countries can get the vaccines that they require, at least proportional to their population. Again, I must also express concern about the emergence, as we have heard, of falsified and substandard vaccines, which are being rumored to be in circulation, which again give reason for concern. Where there's so much demand and supply is low, the criminals can get to work. So we have to be quite aware of that. Here in Nigeria, we have made it very clear that the use of the vaccines will not mean the end of other measures, the non-pharmaceutical measures, the public health measures that we are taking. We stick very much to them. We are going to continue prioritizing them as if the vaccine were not a solution, until we get to the level of 60% minimum that we want to get to for coverage.
Thank you very much for those final remarks. That's all we've time for. I think we've...
Mr. Moni, can I just say one final thing?
Of course.
And that is to say that first, the way that Africa has worked together on this particular issue, the collaboration, the continental collaboration that has been there, not just individual countries, but within individual countries themselves, I think is something to be proud of. But I think that as we discuss this matter, we need to ask ourselves about how to deal with the immediate issue in the medium term and in the long term as well. Dependency on pharmaceutical products and commodities is one of the issues that Africa must really think about and really talk about. Local manufacturing, meaning local manufacturing within the African continent, is something that pharmaceutical companies will need to address at some point. We like the fact that Johnson & Johnson are producing their vaccines in South Africa. And if it's a continental-wide market for them, then it becomes economically very feasible to go that way. So for me, my appeal to my colleagues across the continent is that let's use this experience as the backbone on which we are going to encourage local manufacturing of pharmaceutical commodities and products within the African continent, using the African market as a whole, rather than dealing with these things as individual nations. And I thank you very much.
Thank you very much indeed. An excellent final comment on, potentially how this, the pandemic and the vaccination program can, contribute to, things moving forward in many different areas, from technologies to supply chain capabilities to healthcare systems, etc., and perhaps generate quite a lot of knowledge and more understanding from the pharmaceutical companies about local production in parts of Africa and this kind of thing as well. It's all we have time for, I'm afraid. I think we've just gone maybe a little bit over time. And I want to again thank our very distinguished panel for a very, very interesting and insightful discussion. We had the Honourable Dr. Osagi Ehanire, Minister of Health of Nigeria, Mutahi Kagwe, Cabinet Secretary for Health with the Ministry of Health in Kenya, Kashif Khalid, Regional Director, Africa and the Middle East with the International Air Transport Association, David Hanley, CEO of Mediclinic, and Bruce Orena, the ICRC or Red Cross Head of Delegation and Permanent Representative to the African Union. We very much hope that you have enjoyed the session and found it useful and informative. We look forward to following closely the situation with vaccine rollout in Africa. I hope you enjoy the remainder of the summit and have a very good afternoon.